was 5 years ago this month that the world shut down. Coronavirus was emerging fast and furious. People were dying, hospitals bursting at the seams. Recently, we spoke to two doctors from Brown University Health who were in on the planning even before the pandemic was declared.
We were probably one of the first healthcare systems in the United States to initiate universal masking.
That was at the beginning of the pandemic in March of 2020. They had been preparing for months, had taken a deep dive into the flu pandemic of 1918, and felt they were at least somewhat prepared.
But in reality, we really had no clue. We had an academic knowledge of this, but practically we didn't know what we were facing. We didn't know how to treat this at first.
There were fatal cases that in otherwise healthy people, and I think it was a tragedy and traumatic.
We had no clue how this was going to play out and the enormity of what happened. Initially, we didn't know how to test. We didn't know, we didn't have enough tests. So we would, go out and meet the patient who may have had this disease in their cars and do a swab where we were all decked out in protective gear. And then we instituted more testing sites. We learned how to do this on the go.
The challenge that Dr. Suner and I did not envision, the greatest challenge, neither of us, and I don't think anybody, at least in our positions, realized we had a great plan, but we didn't know there wouldn't be enough N95 respirators. There wouldn't be enough masks. We would run out of hand hygiene product. We would run out of the product we used to clean the hospital. All of that, we ran out. And that wasn't something, at least to my recollection, that we had thought of.
Right.
And that was a staggering challenge in the United States, was shortages of essential equipment.
Elastic band of the masks were brittle and they would break. So we were stapling rubber bands on these masks in order to see if, that would work as a stopgap measure until we got new masks in.
And one of our plastic surgeons was 3D printing prototypes for us to use if needed. So we had to be imaginative of how to carry on to still admit patients yet protect the staff.
By the end of 2020, field hospitals were opening as cases soared. It was like something out of a movie. Every time a patient was discharged, there was a celebration.
We discharged close to 5,000 patients from the hospital, alive and well, with the diagnosis of COVID-19. When the dust had settled, we looked back and, oh my God, what do we do? And many of my colleagues, like Len said, left medicine to do something else. And that, that changed medicine in the United States and probably the world in a very significant way.
Are we prepared for another pandemic of this magnitude?
We've actually started now weekly meetings in our healthcare system, going over all myriad aspects of what would be needed, heaven forbid, if we had a bird flu pandemic. So, lessons learned on reflection, we learned a lot. We know what our challenges are, at least from COVID. And so, we're trying to fill those gaps. And again, we were grateful to the administration taking our recommendations seriously to start these well-organized meetings. And we actually Dr. Suner and I were just both involved last Friday. We did a full day tabletop exercise. So with a lot of people from the administration, various aspects of our healthcare system. So we are keeping it top of mind and utilizing the lessons learned from COVID and applying them to what may come in the future.
I don't know of any time in history where one generation of doctors undertook two pandemics back to back. And there is this phenomenon called pandemic fatigue, where people don't want to hear about, masking again, universal masking, or, shutting down schools, airports, because it's very traumatic, both financially and psychologically. And to do it twice in the same decade is unprecedented. But we're doing our best to plan for it. Hopefully it won't happen.
More than 1.2 million Americans died of COVID-19 during the pandemic, the most of any country. It's something those in healthcare never want to see again, which is why they're planning for the worst, but hoping for the best. I'm NBC 10 Health Check Time reporter Barbara Morse.